Hello ladies and gentlemen, and welcome to this video. This is not going to be quick, this is going to be quite long, but I want to introduce it. I'm only going to be showing you a little bit of the original testimony from the expert witness, and I'm mainly going to be showing you the cross-examination. And the reason why the cross-examination literally lays out every single point that this guy has made. There's an expert witness brought on by Amber Heard's team, a psychologist, and he rips it apart very well. It sort of gets off to a rocky-ish start where he's trying to get the guy to admit that he's been unethical in making, not examining him, but examining him having not spoken to him. But bear with it, because it really gets to a big crescendo where the guy just falls apart and the whole argument is completely ripped apart, debunked. Really, really good. But you do need to bear with it, so I thought I'd introduce it and just sort of explain that. Again, ladies and gents, people who support Amber Heard will have you say that Dr. Curry, an individual that met with Amber, spoke with Amber for hours, her diagnosis, not applicable. But they'll have you believe that this guy, an individual that not once spoke to Johnny Depp, watched a bunch of Pirates of the Caribbean movies to make his assessment, he's credible. Alright, enjoy this highlight, hit subscribe, give the video a share. Cheers.
And is victim blaming a characteristic?
Yes, like I said, to blame the victim, that one of the defenses are the allopathic defense comes along with victim blaming. That's what essentially you're doing. I'm blaming you for what you made me do.
Okay. And is there record evidence that you reviewed that correlates with Mr. Depp engaging in this type of behavior?
So, I think for a lot of the issues seen, the big precipitant was going to be the need for sobriety. Coming back to that severe
Objection, Your Honor, non-responsive.
I think he's trying to explain it. Thank you. Please continue.
The severe substance use disorder, and many of their arguments, but what I reviewed in the record, stemmed around Ms. Heard's desire for Mr. Depp to maintain sobriety, and that what was happening. So as a result, she was blamed for, bothering him in a way he didn't want to be bothered, and that triggered what was going on.
Are you familiar with the term gaslighting?
I'm familiar with the term gaslighting.
Okay. What, if any, gaslighting is consistent with intimate partner violence and the risk factors?
So again, when you start being able to be, when a person starts to be able to be manipulative and charming, you start to be able to win people over. And especially when you see someone who's a victim who is essentially vulnerable, emotionally labile, okay? You see that person, and then you see this calm demeanor in front of you who's very charming, very engaging, very personable, and then all of a sudden it starts looking like the victim is just was essentially losing it, and i.e. they're being gaslighted.
Sir, I'm Wayne Dennison. We haven't met. But let me ask you, let's start with what you finished with.
I'm sorry, one more time?
Let's start with what you finished with. You understand that the court was twice asked by Ms. Heard's counsel to order a medical exam of Mr. Depp, and those motions were denied.
Well, I think your team told the court you didn't want to have them, and the court ruled on them, right? I don't think the court proactively did it. You kind of had a motion to them, right?
No. When Ms. Heard's lawyers moved for them and asked for them and did not get them. Isn't that right, sir?
If you're saying that's what happened, my understanding was that you all did not want him to undergo one. They petitioned for it. The court said no. Yes, that's what my understanding of it was.
The court said no to ordering Mr. Depp to do the medical exam.
Right, I said the court did not require it, right.
And there was one that was ordered, in fact, right?
There was,
All right.
All right, so the last thing you talked about was the goldwater rule.
yes, sir.
Been around for almost 50 years, right?
Yeah, I'm 59. That sounds about right.
Yeah. And it's been around as a result of a presidential election that you referenced.
Yes.
And who has that rule? What organization maintains that rule?
The American Psychiatric Association.
An association you're a member of.
Association that I'm a member of, yes.
Yeah. Aren't you a fellow or something?
Yes, I am.
Okay. So, and this is an ethical rule, right?
It is an ethical rule. And yes, it's ethical. They say rules. It's an ethical guideline. Yes, they're guidelines.
Mm-hmm. And you know that over time, the American Psychiatric Association has amended the rule so it's not just about diagnoses, but it's also about professional opinions.
Could you be more specifically say about professional opinion in regard to what?
Well, let me read this and see if you're familiar with it. It is unethical for a psychiatrist to offer a professional opinion about an individual based on publicly available information without conducting an examination. That's the rule, right?
If you're reading it directly, I will believe you.
Okay. However, a diagnosis is not required for an opinion to be professional. So my question is, it's not just diagnosis that this Goldwater rule applies to, it's professional opinions.
So again, I will reiterate that would come down to essentially nullifying witness testimony, expert witness testimony, without a direct evaluation. And as we know, it didn't happen. But regardless of that, the whole expert witness testimony thing would be basically rendered null and void.
The rule, in fact, contemplates that issue, doesn't it, sir?
Again, I'm just telling you the answer to the question. When you're reading me those statements, I'm telling you the response by the other side, who publishes also, is that if that was the case, there could be no expert witness testimony in the courtroom.
Psychiatrists are ethically prohibited from evaluating individuals without permission or other authorization, such as a court order. That's the rule, right?
Again, if you're reading that, then I have to believe you're not misrepresenting it. And I would come back to, again, then this whole thing on we might as well get rid of all the expert witnesses we've had throughout all of time for court proceedings. Because what you're saying is unless a court orders it, and that's what you just said, or the APA said, then therefore expert witnesses cannot do an evaluation based on an observation of the medical records. Insurance companies cannot do evaluations solely based on medical records where they're doctors rendering professional opinions. So at the end of the day, you are essentially saying that unless someone has directly evaluated it, this whole medical system we have, this whole legal system we have, is null and void.
I'm not saying...
No, yes, you are, sir. No, you are.
Well, give me a second, and I'll give you more than a second. What I'm saying and what I am reading to you is a rule by your organization that takes into account that there could be court orders that would permit the exact kind of evaluation that you say I'm eliminating.
And I think we're going in circles because I think I just said that means expert witness testimony would not be allowed, and the branch of forensic psychiatry would be especially hindered. And we know the branch of forensic psychiatry does not prohibit that. So I am a member of the APA. That doesn't necessarily mean every single thing they put in there, everybody has to uncategorically agree with, because clearly that's not the case.
Did you agree in your deposition that the professional opinions you rendered were inconsistent with the Goldwater rule?
My first position, if we're saying that if the Goldwater rule says, and I very much said that during deposition, that the Goldwater rule was made for presidents and public figures such as that, but regardless of that, because that's what it was made for. It's not made for Hollywood, but I'll even take that Mr. Depp's a public figure. What I'm saying to you is that the Goldwater rule is saying we cannot do any expert witness testimony in our field. That is exactly what the Goldwater rule is saying based on exactly what you read. And I'm just telling you what you are saying that rule encompasses.
What I'm asking you, sir, is did you comply with the ethical requirements of the APA when rendering the professional opinions that you've rendered today?
It is a requirement of the APA. It is not the requirement of the APA. Secondarily,
so the answer is no.
Secondarily, again, in order to not, we wasted our whole morning because there was an expert witness before me. There's an expert witness everyone brought in. So all I'm saying to you, that means the whole field of medical legal law is corrupt and unethical for engaging in an act that the APA clearly says we should not do. So if you're saying that, then the answer is yes, I'm agreeing with that statement.
You're agreeing that the APA would deem your testimony and your professional opinions rendered unethical.
I am saying you are saying that I'm an expert witness. I am saying as an expert witness and solely as an expert witness, that guideline is permitting that from occurring. I would say then that the whole field of expert witness testimony, again, would be disavowed by what you are quoting in the Goldwater rule. And we know that's not the case, because if it was, we would not be allowed to do it.
And you said the rule was for presidents, right? And
that was initially for presidents, yes.
Well, and the name of the rule came from that. But the rule says it is unethical for a psychiatrist to offer a professional opinion about an individual. That's right, sir. It's not just presidents, it's not public figures, it's individuals.
Funny, it was named after according to your logic, if you don't put something in the title, it's not true. That's what you told me this morning, I believe, about my intimate partner violence. So what I would say to you then, sir, is that if you say this about an individual, again, any court would have to render an expert witness testimony invalid. Any doctor that reviews charts would have to render it invalid. I can go on the list of docs that do not see or interview patients directly, and that's a violation. So basically, you are saying that unless you do a direct clinical evaluation, then all of the field of forensic psychiatry and all of managed care is doing an unethical violation because we are not seeing the presence. We deny patients medications all the time without seeing them. We deny patients treatments, unfortunately, without seeing them. And I'm on the receiving end of that. So the answer to your question, again, unless you are saying to me that all of this is unethical, which is what you are saying. This is how I'm interpreting what you are saying to me. That unless you do the evaluation directly yourself, therefore, it could not be considered ethical. And I'm telling you how that's applicable to not just expert law, but also managed care. It's applicable to multiple branches of medicine. Duration of hospitalization stay, they get evaluated. So tell me where you want me to end this.
Well,
sir.
why don't we talk about what you just testified to? Because I didn't ask you anything about that. I asked you whether, under this rubric, under this principle of medical ethics, have you acted unethically? Yes or no?
No. As an expert witness, I have not acted unethically. And if you want the jury to believe that expert witnesses are unethical, then I guess that's for them to decide.
Yes
that's
or no,
for them
sir.
to
You
decide.
said no. Let's go to the next question.
Okay.
Right? Psychiatric diagnosis occurs in the context of an evaluation based on thorough history-taking, examination, and where applicable, collated or collateral information. You'll agree with that?
I believe I said that earlier, yes.
Yeah. And it's a departure from the methods of the profession to render an opinion without an examination and without conducting an evaluation in accordance with the standards of psychiatric practice, correct?
Well, again, by the way, for the record, intimate partner violence is not a psychiatric diagnosis. I'll start with that. Substance usage by themselves is not a psychiatric diagnosis. If you want to cut to the chase, psychiatry is not a diagnosis of that. Narcissistic personality traits is not a diagnosis. Ergo, I am basically commenting on the things that were brought to me, which are not diagnosis. But an evaluation, if I was going to treat a patient or anyone here, those are the steps I would take.
We, I think, started with the notion that this rule applies broader than diagnoses. It applies to professional opinions.
I believe you just
rendered
quoted
professional opinions relative to narcissistic personality traits, haven't you, sir? Relative to Mr. Depp.
Again, I believe you just commented on what it takes to do in a psychiatric evaluation to establish a diagnosis. I'm almost certain that's what you said. And maybe I'm wrong. Maybe you didn't say that, but I'm sure you did. And therefore, what I'm saying is neither IPV nor substance usage, nor narcissistic personality traits a psychiatric diagnosis. And then under the rubric of expert witness testimony, you are saying I acted unethically under the rubric of expert witness testimony. So if you, sir, would like to proceed that expert witnesses are unethical, based on that, I am not going to sit here and disagree with you and waste everyone's time. I think it's fairly obvious. So thank you. I'll go ahead. These were your words. I'm just saying them back how they're interpreted.
Okay. Let's start with the easy question then. Maybe we can.
That was pretty easy. Go ahead.
All right, Doctor, you're going to have to just answer the questions.
Okay. Sorry about that. Getting into it.
You need to just answer the questions,
Okay.
Dr. Spiegel.
You are not rendering any diagnosis whatsoever of Mr. Depp today or ever.
No, I probably would say to you that certainly I would not say narcissistic personality, or I would say traits. Certainly from what I have read, intimate partner violence is not a diagnosis. So the answer is no for that. Narcissistic personality traits is not a diagnosis. The answer is no. But if you want to tell me that substance use disorder is a psychiatric diagnosis, the answer is yes.
But that wasn't an issue, was it? Whether Mr. Depp used substances? I mean, you said you've gone through the record. That wasn't really an issue at this trial. He's said it from day one.
Oh, so you're saying he's already admitted to the diagnosis?
He's already admitted to the use of the substances.
Well, again, there's a difference between admitting to substance use and substance use disorder.
Let's go back to what you just said about narcissistic personality traits.
Yes.
Narcissistic personality disorder is a DSM-5 diagnosis, correct?
Correct.
Diagnostic personality, and you haven't testified that Mr. Depp has narcissistic personality disorder, have you?
I would certainly, if I didn't, I'm certainly thinking that, but at least I'm going to say he has traits, which are characteristics of provisional diagnosis of, it's a provisional diagnosis of probably narcissistic personality disorder. But yeah, I mean, I do believe that.
Well, but when you say provisional diagnosis, you know the DSM-5 requires, in order to find that diagnosis, 5 of the 9 factors. Mm-hmm. And you haven't done that analysis. You've never made that diagnosis. You've just identified certain factors
that are criteria for the diagnosis.
Right. But you need 5 of 9 to get to the diagnosis. You've already told us that you didn't make a diagnosis. You're just identifying traits, correct?
I'm identifying traits that are consistent with the diagnosis, yes.
Right. And did you testify in deposition that the existence of traits, as opposed to the disorder, doesn't have a correlation with IPV?
If I said traits do not have a correlation with the, if that's what I said, and I don't remember saying that, but that wouldn't be a correct thing. Narcissism has a correlation with the diagnosis. Yes, that part's true.
All right, how far are we going to back this up? Because there's a diagnosis of narcissistic personality disorder, right?
Yes, sir.
And that one is tied, has some correlation with IPV, right?
narcissism has correlation with IP. Again, you're not allowing me to answer. You're splitting hairs. You're splitting hairs between the traits that are consistent with, which all I'm commenting on is behaviors and traits that are consistent with the diagnosis and Mr. Depp. Narcissism absolutely has risk factors associated with IPV.
Let's go back again, and maybe we can focus on the question I ask you, and we can get an answer that's addressed to that question.
Mm-hmm.
Narcissistic personality disorder is a risk factor for IPV, yes or no?
Yes.
And you've previously testified that there is no literature at which you are currently aware that the mere presence of narcissistic traits is a risk factor for IPV.
Am I answering the question?
Yes.
That's incorrect.
You didn't testify to that.
Cluster B traits, which narcissistic personality disorder is part of, is a huge risk factor for intimate partner violence, which cluster B traits include narcissistic personality disorder, antisocial personality disorder, amongst others. So the answer to the question is every resource on intimate partner violence will support that cluster B traits, where narcissistic personality falls under, is a risk factor for intimate partner violence.
Any single trait is a risk factor for IPV.
Again, I will repeat, cluster B traits. I didn't say any trait. I said cluster. No,
Let me be more precise then.
Okay.
Any narcissistic trait in and of itself is a risk factor for IPV.
But you are mischaracterizing what I said. What I said, I'm pretty sure I said cluster. If you look at all the intimate partner violence literature, and it would behoove you to do so, you will see that cluster B traits, I didn't say narcissistic per se, cluster B traits, where narcissistic personality disorder is part of, are risk factors for intimate partner violence, part and parcel, uniformly true. And I'm not sure, the thing I don't understand is, I'm not sure why we're arguing psychiatry, because I'm telling you what it is.
Dr. Siegel, you just need to answer the questions.
Okay.
So you want to talk about cluster B, so let's do that for a minute. Borderline personality disorder is a risk factor for IPV.
As part of cluster B traits, yes.
Histrionic personality disorder is a risk factor for IPV.
Less so.
But it
Less so. Less so. I mean,
cluster-
it's a risk factor, but less so, yes.
Yeah.
Less so. Significantly less so.
All right. So which traits under narcissistic, before I move on there, there's only been one diagnosis in court of personality disorders, correct?
I'm not sure who you're referring to. Are you referring to Mr. Depp, Ms. Hurt? I'm not sure what you were talking about.
Do you understand that there was a medical examination done of Ms. Hurt?
Yes, I did.
Do you understand that the testimony was ultimately that Ms. Hurd suffers from 2 personality disorders?
Okay, so I'm just being specific. I just wanted to know if you're talking about Ms. Hurt or Mr. Depp. So that's all I was asking you.
Yes or no to my question?
Which was there's only one diagnosis of, Ms. Hurd was diagnosed with that.
Yeah. And both of the diagnoses are in cluster B, and both of them are risk factors for IPV.
But both those cluster B things are, I'm not allowed to comment on the testing, so therefore, all I can say is that cluster B traits, and I'll tell you what they are, and by the way, I testified this before, which was that, 1, I don't expect perfection from my victims. 2, absolutely there were cluster B traits Ms. Hurd had. Absolutely Ms. Hurd had cluster
Given that
B.
you've testified to it before, let's move on to a new question.
Okay.
All right? You indicated, in your opinion today, that you thought, well, why don't we move a little differently? Are you a member of the American Medical Association?
No.
Okay, so you don't know what the ethical rule of the American Medical Association is relative to doing clinical diagnoses about individuals you've never talked to.
So you're saying in terms of doing expert witness evaluations, under that rubric, right?
I'm just asking you, do you know the AMA's rule?
You're saying the AMA's ruling under the rubric of not doing evaluation with somebody you did not see, and I'm questioning, I'm asking, so you are talking about expert witness testimony?
No, I'm talking about, do you know the rule?
I'm not a member of the AMA, so I
Okay,
don't
great.
read the rubric.
We can move on. You don't know the rule.
Huh?
All right. You rendered an opinion about Mr. Depp's purported cognitive impairment.
Yes.
Yeah. What do you use as a baseline?
A baseline for processing speed?
Yeah, for analyzing Mr. Depp before you watched his deposition.
What do I use a baseline for that?
Yeah.
I mean, I guess my baseline would probably be how I've seen him interact in public. How I've seen him interact with others. I've seen him interact in media. I've seen him interact and his process speed is certainly not slow. I've seen him do commercials. His process speed was not slow.
At deposition, didn't you say that what you did was compare Mr. Depp's performance in lots of pirate movies against his deposition testimony here?
What I said was I've seen Mr. Depp do apology ads. I remember he did an apology ad with Bad Dog with no delay in process speed. I've seen him interact with the media regarding to that. I saw no delay in processing speed. All I'm saying
Let me ask you about pirates, though. You compared pirates to the to the depositions given in this case.
Then I apologize for what I said. Then I misspoke.
You misspoke? You didn't make the comparison?
Right now, just a second ago? Just a second ago, I may have said that I misspoke. I apologize, I misspoke.
Okay. Because you know you can't compare pirates to sworn testimony, right?
Yes.
Okay.
But but as an aside, you can judge someone's processing speed at any time. Like I'm judging yours right now, you're judging mine. We all judge processing speed as a baseline because of what we know about each other. And I would say your processing speed right now is not slow. So,
Thank
I
you.
mean, we're judging processing speed. I'm just saying to you.
Yeah. But no, any of Mr. Depp's other portrayals in movies, did that affect your analysis of processing speed?
Only I've seen him interact on interviews, and that was it.
Right.
When he wasn't in movies.
Right. But Willy Wonka doesn't matter to you? You see him in that movie, Charlie and Chocolate Factory? Did you look at that one when you were comparing his processing speed?
Do I have to answer that question, Your Honor?
You have to answer questions. Yes, sir.
No, you'll be happy to know I didn't see Willy Wonka I didn't see 21 Jump Street when it happened, or whatever it was about. No, I did not.
All right. You made a very kind admission, I think, early on in your deposition, that you're not claiming to be a better actor than Mr. Depp. That's correct, isn't it?
100%.
All right. But with respect to acting, you know that actors actually rehearse for their parts and work on the language, diction, timing of their dialogue as part of that rehearsal?
If you say that, I'm not an actor, so I don't know what goes on. I can't tell you. I have no idea what goes on in acting.
Okay. But you don't know enough about acting to know whether actors rehearse?
Sir, I am not an expert in acting. I have no idea what an actor does.
Okay. During your deposition, what were the circumstances under which you decided to call Mr. Depp an idiot?
Under somebody call Mr. Depp an idiot?
Yeah, you called Mr. Depp an idiot in your deposition. Why
Oh, I
did you
think.
do that?
Okay. So I think it was in the context. I think it was in the. You probably should read the context of it, because I think the context was, and I'm trying to think back. Okay. And what I thought it was related to was if you're coming to some deposition. Okay. And again, I'm thinking back. So you have it in front of you. I don't. So I'm thinking back where he's coming in from Europe for a deposition, video deposition that he gave, and he took it overnight the night before. And what I think I said was that if you're going to do a major thing to a trial that you're involved with, I think you'd be an idiot to come in the night before.
All right.
So I didn't call Mr. Depp an idiot. I certainly called that planning an idiot. I didn't call him an idiot.
So the words, so I mean he's an idiot, are mistranscribed?
No, I'm sure, again, if I said it in that, if you're just reading one line, one snippet, I'm sure it was in the context I just said. But again, you have it in front of you, I don't.
Yeah. Is idiot a professional opinion?
I wasn't rendering professional opinion.
Yeah.
No.
Is it a psychiatric opinion?
And that follows the goldwater rule.
How does it follow the?
Oh, you just said that I'm not rendering a professional opinion. I just said idiot. That's not a goldwater.
So idiot is not a professional opinion? Mm-hmm. Is it your practice to describe people as idiots?
My practice describe people. In my practice? No, I don't describe people my clinical cases as idiots or patients as idiots or victims as idiots. No, sir.
But you sat for a deposition in this case and described the plaintiff as an idiot, correct?
You gave me 9 hours of deposition, and if I said the word idiot, it was an idiot in planning. It wasn't making him an idiot. I don't know Mr. Depp's IQ. I don't know his overall functioning. So therefore, if I said it, it was an idiot in planning, which is what I meant to come across as.
All right. So you did say you don't know his overall functioning, but you made some testimony today as to some evaluations you made relative to his functioning. You would agree with me that it's probably a good idea to think about the questions that are asked you in a court proceeding before answering them.
Am I allowed to answer that question?
Yes.
Okay. So what I meant by function, what I said by function, I believe that his agent reported how late he was showing up to every movie while the cast is waiting for him. I believe that would be an impairment. If I showed up late for that, I would not be here right now, would not have a job. Okay? I believe the thing was in terms of balking out of treatment for substance rehab that his doctor is prescribing for him. So if you're asking me if that's an impairment of functioning, I would say I'm very much substantiated in that.
I'm trying to understand how you got to this notion of cognitive decline. And I thought it was based at least in part on the manner in which he testified.
I'm sorry, what?
On the manner in which he testified.
On the manner, I'm sorry, I'm not being difficult. I can't hear. I'm sorry. On what?
I was asking you about the cognitive decline
Yes.
testimony that you made.
Yes.
And it was my understanding that at least a portion of that testimony that you rendered was that you derived some evidence of cognitive decline from the way Mr. Depp testified.
Yes.
Okay.
And that's what I said, yes.
Right. And so all I'm asking you is, don't you think it's a good idea when you're in the middle of a court proceeding to answer questions carefully?
Again, professionally, we diagnose patients with a neurocog disorder by gross evaluation all the time with cognitive. On the thought that, again, age normal controls, I'm just saying, age normative controls does not put a 58-year-old gentleman at that processing. That's all I'm saying. That's
Right.
all I said.
And you derived this without ever once talking to the man.
You mean me directly talking to him? Because we know how I derived it. So you're talking about me directly talking to him?
Yeah, you never talked.
No, I've never talked to him.
Right. And this exam you gave, well, you did talk about Dr. Blaustein, right?
Yes, sir.
And you understand that the entirety of Dr. Blaustein's medical records are 12 pages of handwritten notes.
The important part was what I said. For me, as an example of cognition, which I'm trying to prove, which is what you asked me, the important part was what I said. And that was irrefutable.
The important part is that he gave the mini mental status exam?
Yes, sir.
All right.
That's
Let's
a
talk
cognitive-
about the mini mental status exam. Scored on a 30-point scale, right?
Yes.
All right. And it's an exam that basically is most often used for, what, Alzheimer's, dementia, those kind of testing?
It's an exam that tests cognition in all psychiatric illnesses, not just Alzheimer's. It was made for dementia, for Alzheimer's, but is the standard, has been the standard for testing cognition in all psychiatric illness, substance use disorders included.
Okay. Now, there is an element of that exam that requires drawing, correct?
Yes.
So you don't know what drawing Mr. Depp did or whether the drawing should have been fully scored.
I wasn't questioning his visual spatial perceptual skills, which is what that does.
Right. And you don't know what score Mr. Depp received on the exam.
I was very specific. I know 3 words, not remembering at 5 minutes. That's all I said.
3 words, not remembering 5 minutes, and he remembered one of them, right?
From what I understand, you didn't remember any of them.
All right. Memory on the exam. Out of the 30 points, what's it worth? 3. 3, right? Memory is 3 out of the 30.
Yeah, memory's 3.
Okay.
But again, the memory section in and of itself tests memory. That's the only question that tests memory. Only section that actually tests memory.
So the memory section tests memory. It's the only section you testified about. And for all you know, that with respect to the exam that you're relying on, Mr. Depp scored 27 out of 30.
And that would be telling, though, cognitive, if you score 27 out of 30 and you miss 3 points on memory. That would be very telling.
You don't know if Mr. Depp had been up all night the night before.
Again, you wouldn't expect to not recall any words at 3 minutes unless there's a cognitive issue.
You don't know if Mr. Depp was high.
And again, now that could affect memory, but I'm not refuting that. I'm not refuting that at all. He could have been high, he could have been drunk, he could have been using cocaine, and that would absolutely affect his memory, which is what I said. Yes, you're right.
So ultimately, you have no idea what state Mr. Depp was in at the time he took the exam that you're relying on.
Short of what you just said about drugs and alcohol, okay, there shouldn't be a reason why a 58-year-old also with strokes and other neurocognitive conditions, but short of that, there shouldn't be a really good reason why someone at that age shouldn't come up with at least one. But an answer.
But wait a minute, you started that question with short of drugs and alcohol and spent 35 minutes talking about his use of drugs and alcohol. Isn't that right?
Oh, I'm agreeing. I thought I agreed with you. I think I agreed. I said that drugs and alcohol can absolutely affect cognition. I'm not sure. I agree, but I'm not sure if that's a problem. I agree with you on that.
All right. So you don't know, one way or the other, how he scored on the exam. You don't know whether he was at the time on drugs and alcohol, but you're going to rely on it in your testimony to say that he's cognitively impaired.
Which is what we do in clinical medicine, sir.
Okay. You rely on tests that you don't know when it was administered, you don't know the score of the test, and you don't know the state of the person being tested, but you're going to rely on it anyway.
Again, if we had to know every test, when people get the mini mental state exam, we have no idea clinically if they are high, wasted, stoned, stroke. We have no idea. So if you're going to say that, that means everybody needs a drug test before they do a mini mental study, and that's not the standard of care. And I think you know that. So
let's talk a little bit about this word you kept using, correlation. You know the word, right?
yes.
Correlation and causation aren't the same thing, are they, sir?
No, they're not the same thing.
No, how are they different?
Correlation is consistent with causation, is direct link.
Can you say that again? You were so fast I didn't hear it.
I'm sorry about that. Correlation is a risk for something happening. Causation is a direct link.
Right. So just because something's correlated doesn't mean it's going to happen.
100%.
Right.
100%.
Like lung cancer, for instance. Smoking is very highly correlated with lung cancer, right?
Yeah, and there's certainly a link
Right.
to lung cancer and smoking.
Right. But not all smokers get lung cancer.
Not all smokers do. No one, like I said, no one fits the curve perfectly.
Right. And you've made repeated testimony to all of us. All of us do this. All of us do that. Mm-hmm. Your suggestion about all of us is you're just looking at the world as a sample and not at any particular individual, correct?
What I'm looking at is that I am not talking about an individual, how they can or cannot be resistant. What I'm saying is invariably, when you use substances, this is going to happen. Now, is there a 0.05% chance that someone who does? Absolutely there is. But is that medical degree of certainty? Absolutely not.
A 0.05% chance of what, sir?
Of eventually developing symptoms. If you're using excessively, eventually you're going to develop symptoms.
All right. But risk factors tell us nothing about any one particular individual, do they, sir?
No. Again, risk factors tell us nothing except that they have it, they're at a higher likelihood of developing it. That's
right.
what it tells us.
But you did a whole litany of risk factors relative to IPV.
Yes.
Right. And none of those risk factors tell us anything specifically about an individual.
Other than they're at higher risk. Right.
Right. So someone could have every single risk factor for IPV and never commit IPV, right?
It would be, again, if you're going to say a medical degree of probability, the answer is they will. But if you're saying uniformly, the answer is no.
Right. IPV can occur without substance abuse.
Oh, sure.
Someone can abuse substances without ever perpetrating IPV.
Again, absolutely. But, again, you are saying different than what I said. I did not say abusing substances. I said substance use disorder. Those are two different things, because there are surely people who use substances that do not engage in any violence, do not become psychotic, nothing at all. So
and that's
absolutely.
equally true of people who have substance abuse disorder. There are certainly people who have substance abuse disorder who don't commit IPV, correct?
They are saying people who have substance use disorders, the majority of them, over 50% do. So over 50% do. So that's medical.
The answer is yes.
As you said, not everyone who smokes gets lung cancer.
So there are significant numbers of people. You said it was over 50. So you'd say 40% of the people who have substance abuse disorder don't commit IPV?
And those are the ones that do not have IPV risk factors, right? So we're talking about people
wait a
who
minute.
don't.
Isn't substance abuse disorder an IPV risk factor?
Oh, yeah. These are other people that don't have other risk factors, right?
Right. But again, we're talking about people in general. You don't know anything about any particular individual as to whether anybody's going to commit IPV.
If statistics follow through, all we can say is more than 50%, 70% will. If you combine more risk factors you have, the more likely you're going to develop the illness. If you smoke cigarettes once, that might not correlate to lung cancer. If you smoke it chronically, that might.
Right.
So that's all I'm
we're
saying.
talking about individuals here. You either have lung cancer or you don't, right?
If you're smoking.
Right.
Right.
You either commit IPV or you didn't.
I mean, yeah, you either did or you didn't, yes.
Right. So you took some issue with me because I was asking about substance abuse generally. And you wanted me to talk about the disorder. I asked you earlier about narcissistic personality disorder, and you haven't made that diagnosis. You've just talked about the traits, right?
Yes.
And somebody can have these narcissistic personality traits and substance abuse disorder and never commit IPV, right?
So, along that line,
Right.
about 80 to 90% of people who commit IPV have a personality disorder. So the answer is less than about 10% obviously do not.
There are more close links with IPV for borderline personality disorder than narcissistic personality disorder. Correct, sir?
I'm not going to agree with that.
No?
I'm not saying there are more links. I would say to you there are absolute. If you're asking me if there are links, the answer is absolutely. If you're saying to me more, I can show studies say yes, show studies say that. That has not been absolutely definitively correlated. No.
No.
Absolutely not.
MDMA. What is it?
Ecstasy.
Yeah. And what's the normal dosage of ecstasy for people who use ecstasy?
Again, I couldn't tell you the quote unquote normal dose because honestly speaking, no one knows what they're getting when they're using it, right? It's not regulated, so.
But the effects of ecstasy enhance sense of well-being?
At low doses, the answer is yes. I'm going to gather when you're using it at higher doses and develop tolerance, you develop the sympathomimetic effects, which are not so enhanced well-being.
Increased extroversion, that's a symptom?
Again, at lower doses, you are 100% right. At low amounts, you are 100% right. It is an entactogen. We feel closer to people. That's what people who use it say. They feel close to people, warmth to people, 100%. But with continual use and higher doses, it can be fatal.
Right.
So that's not well-being. I don't know if I call that well-being.
So continued use at higher doses, MDMA can be fatal, correct?
Correct.
What if you took 8 to 10 tablets of MDMA?
What if you took again, you don't know what it's very hard to say that. You don't know what it's, what's the word I'm looking for? Contaminated with, okay? You can't just say, hey, let me just take 8 to 10 pure ecstasy and see what happens. That's not going to happen. So what I would say to you, again, because substance abuse are unpredictable, they are not regulated, no one knows what they're going to. No one absolutely has any idea whether it's going to cause this empathic entactogen effect at very low doses, or is it going to cause the sympathomimetic, increase, it's like a stimulant, like cocaine and stuff we talked about like that. No one knows what's going to happen. It's not regulated. And no one knows if you're using with other substances either, like other stimulants.
Or if you mix it with alcohol.
Or if you mix it with alcohol. No one knows if it's going to be potentially worse.
Right. But this is a potentially lethal combination. 8 to 10 MDMA tablets and alcohol.
This is a potentially toxic combination.
Right.
Can it kill you? Yeah, I mean, it is a potentially toxic combination. That's true.
Ever heard of someone cutting off their own finger on MDMA?
Have I ever heard of it?
Yeah.
No, I can only give you one example.
Hadn't seen that one before. Okay. So, Seroquel. That one puts you to sleep, right?
If you want to phrase a barbiturate putting you to sleep, then the answer is yes.
Yeah, you heard Mr. Depp talking about sometimes being on the nod, right?
And again, I think I explained Seroquel very well this morning.
Good. I'm going to ask him a few more questions.
Oh, okay. Okay.
All right. You kept making references to street value. Why were you doing that?
Because that's why people with substance use disorder use quetiapine and Seroquel.
Say it again, I'm sorry.
That's why people who use quetiapine or slash Seroquel it sells on the street because it's so barbiturate-like in effect.
Right, but you said that Mr. Depp had a prescription.
There are many substance use disorder patients who have prescriptions for Adderall and quetiapine from their doctor, and that doesn't mean they're not getting high out of it. That doesn't take much. Doctors like to believe what patients have to say. They're not going to go in there being expert witness testimony. All I'm telling you is that in people who have substance use disorder, it is not uncommon, and the thought was initially that because quetiapine was not addicting, that it's safe to give in people with substance use disorders, when in fact, we absolutely know it has street value. We absolutely know that for a fact.
Right, but my point about this is you made a bunch of testimony about street value, but you knew at the time you made the testimony that Mr. Depp, in fact, had a prescription.
He also had a prescription for oxycodone and roxicodone. Does that count? Because that's also probably not a good thing. Just because you have a prescription doesn't mean that...
I think Mr. Depp would agree with you it wasn't a good thing.
Just because you have a prescription doesn't mean you can't abuse it.
No, I'm not suggesting you're abusing it. I'm just wondering why your testimony was in any way tied to street value when every single drug you referenced, Mr. Depp had legally.
Again, you can have prescription substance abuse, and we know that, correct? No, I shouldn't be asking that. We can have prescription substance use disorders, and that's not uncommon if you look at the opiate epidemic that we're living in right now. We can have that. That's not an uncommon thing. Unfortunate, but uncommon. Not uncommon.
So, Seroquel, I think you described as a sleeping agent when used off-label?
When I saw what?
Sleeping agent, Seroquel, when used off-label?
When used off-label, it's used. It can be used sleeping agent, yes.
Right. So, Mr. Depp's use of Seroquel could account for some of the photos we saw in this trial, where he's asleep in a chair?
Again, what I would say to you is that if you have a substance use disorder, you are using it to be knocked out. Yes, I agree, but I'm not sure at the end of the day if she'd have vomitus over you either, because I've never seen Seroquel do that. So when he was passed out in the chair, he also had vomitus over him. I've never seen Seroquel do that ever.
Neurontin is another one of the drugs you testified about. That one's also prescribed, right?
Yes, it is.
And what's the prescription for that?
What's it used for? And what's its indication, or what's its used?
What's its indication?
I mean, its indication is for seizures. It may have one pain indication. Again, I'm not a neurologist, so I can't tell you exactly if it does. But it's chronically used off-label for pain. It's used off-label for anxiety.
Right. And what's its effect? That's another one that'll put you to sleep, right?
Well, yeah. I mean, sure, 100%.
Right. And you made reference to a picture. There's been testimony around that picture that Mr. Depp fell asleep with ice cream in his hand. That's not vomitous, right?
I was told it was vomitous.
Okay. You talked about the fact that Mr. Depp indicates that from time to time he uses an earpiece.
I read that, yes.
Okay. Did you read the testimony of Mr. Wyatt, who told you what was being pumped into that earpiece?
Yeah, I mean, if I remember right, I mean, I think it was lines, right?
No, it was music.
It was music, not his lines?
Yeah.
Oh, okay.
So if Mr. Depp was listening to music rather than being fed his lines, does that change your opinion as to his cognitive function?
If he was never fed his lines through the earpiece, which I know he was, but read he was, and that may have been that example, Mr. Wyatt may have said that it was music. I guess the question is, were you having the music during the actual talking of your lines? Is that what you're saying to me?
Well, you know, if you can do two things at once, that's a pretty high cognitive function, isn't it, sir?
You know, it's a very good point, actually. Divided attention is something humans have a lot of trouble in. So, for instance, we have trouble driving and putting on the, using our cell phones and direct. So, divided attention, humans actually are not very good at. I'll put that out there.
But Mr.
In general, not just Mr. Depp, in general.
But Mr. Depp is pretty good at acting. You acknowledged that early on.
Absolutely. Well, better than me, so I know that.
Because you don't act. In fact, you don't know about acting.
You're right. I have no idea about acting.
And you don't know how prevalent the use of earpieces are in acting.
Again, I know nothing about acting.
Irrespective of the fact you know nothing about acting, you've testified that Mr. Depp's use of an earpiece is somehow a cognitive deficit.
So if I was giving a lecture and I was fed my lines, I would think there's a cognitive deficit. So and maybe I'm wrong. Like I said, maybe I could be wrong. Maybe Hollywood stars get lines fed to them through earpieces all the time, and I don't know. That could be said. It sounded to me to be unusual if you're doing a movie and you don't know the lines. But like you said, I'm just judging what I do with lectures, and that would never happen.
If you gave lectures, you wouldn't use an earpiece, but you're not going to tell anybody how to act.
I'm sorry, what was the question?
I said if you gave lectures, you wouldn't use an earpiece, but you're not telling anybody how to act.
Right, I would not use an earpiece during lectures.
Right.
But I don't know what the standard for standard as Hollywood is for that. I have no idea.
Your testimony about the use of an earpiece, as maybe you were wrong. You're comfortable with the fact that you may have made a mistake there?
No, because I think in the basis of what I've read about it, I'm comfortable that I don't believe that actors are routinely given their entire script through earpieces. I find that hard to believe.
Yeah,
but
there's not one whit of evidence that this ever happened here.
I guess what I said. I just said I find it hard to believe. I didn't say it. I said I find it hard to believe. That's all I said.
Oh yeah, but what you found hard to believe, sir, was that every line of the script was pumped through an earpiece. Where did you ever get the idea that occurred?
That's what that's what I read in the court review, the court evidence. That's where I got it from.
Right. And you know whether Marlon Brando used an earpiece?
Isn't he dead?
Yeah.
So the answer is no. He does not use one now.
Oh no, I used the past tense, sir.
Oh, I'm sorry. I know nothing. I will concede to you, I know nothing about acting. I will concede to you 100%. If that is the standard and people are done that acting, then I apologize and that was wrong on my part. If that's the standard, I'm wrong. I don't know.
Okay. Let's go with that. No further questions.
All right. How long is your return?